Let's talk about an advanced area to inject and the proper technique, the piriform fossa. The piriform fossa is this cavity right here that sits at the base of the nose on both sides. And as we age, we have bone resorption there, which causes a deeper nasolabial fold, which then creates a marionette line as well. Now, oftentimes patients will come in and they will complain about this area first. They will always say this is what they're noticing, and they're not wrong. They're noticing that deep crease in here, but what you should not be doing is inject that area first. You always want to inject superior and laterally first to help pull back as much as you can and camouflage the fold. So there's two different injection techniques for this. You can use a cannula, 25 gauge, or you can use a needle, 27 gauge. For each injection technique, you want to use something that has a high G prime because we want to correct bone resorption on the maxilla. Now, if you're going to use a needle, you can do it on a 90-degree angle, come straight in, and you do not want to inject more than a 0.2 bolus, and you want to inject very slowly. You want to remember that the facial artery comes up and branches. Now, in the majority of people, it gets very superficial here, so you are safe to do deep needle to bone. But in a small percentage of people, that artery lies on bone. Your safe injection technique is going to be injecting slowly. You're going to aspirate before you inject, and you want your needle to be unprimed. So when you do aspirate, it can pick up blood if it is in an artery. Now, if you're going to use a cannula, you want to make your entry point 1 to 1.5 centimeters from the oral commissure, and you want to come in, and again, the goal is to inject slowly, aspirate, and you want to inject a bolus in there as close to bone as you can get it with your cannula. Now, you want to inject on bone in this area because you want to think about what are we trying to emulate. We're trying to emulate bone, so you want to get as close to it as possible. Also, injecting on bone is going to help prevent any filler migration that can make this fold heavier. When you're injecting with cannula on that area, you can do a little bit more than a 0.2 bolus as you would do with needle, and that's because you're gonna have a little bit more space when you're using a cannula. Now that we've perfected the technique, we can inject close to bone, on bone, and really fill in those smile lines, those nasolabial fold lines. On this particular client, she was bothered by her nasolabial fold lines, and we first started with pulling up her cheek a little bit to give way to that fold, and then we went right into that piriform fossa. On her, I injected needle to bone. I used a high G prime filler, and I did 0.2, and I did it very slowly. I aspirated before, and you can even tell it pulled up her lip just ever so slightly, and it really filled in that cavity. And we're trying to prevent a deeper nasolabial fold on her. And it, over time, and once it integrates with the tissue, you're gonna see it fill even more.